Professor Charlie Craddock, OBE, is the co-founder of Cure Leukaemia and is based at Queen Elizabeth Hospital in Birmingham. Good morning to you.
Good morning.
That's terribly sad news about Carl Ikeme, but tell us what exactly acute leukemia is, if you could.
Yes, so obviously I can't comment on the individual case, but what we do know is that as a general condition, acute leukemia is a cancer of the bone marrow, and the cancerous cells stop the bone marrow producing the red cells, which are essential for carrying our oxygen and without which we become anemic, the white cells that fight infection, and the platelets that stop us bleeding. So the presentation of acute leukemia can either be quite indolent, with patients gradually feeling more and more tired and presenting to their doctor with fatigue, or it can actually be quite abrupt, presenting with infection and fever or with bleeding. The diagnosis is confirmed by a bone marrow test, and then the most important thing is that we proceed quickly to intensive chemotherapy to get patients into a remission. I think the important thing about this disease is it's a very serious condition, but there's a real increasing hope that we can offer curative therapies, whether it's in the form of chemotherapy or increasingly bone marrow transplantation, so that an increasing number of adults and children with acute leukemia now have a prospect of cure.
So it's not the death sentence it was?
No, we clearly don't succeed in delivering curative therapy to many patients, and it's a really active area of research. But there's been immense progress in the use of both drug and transplant therapies in the last 10 years. And the exciting thing is that Birmingham, particularly at the Centre for Clinical Haematology at the Queen Elizabeth Hospital, is now a leading international centre for rapidly introducing and assessing new drug and transplant therapies.
So treatment options are improving all the time, as is the prognosis, I hope.
Yeah, no, that's absolutely right. We're much better now at classifying which patients will do well with chemotherapy alone. And in fact, the chemotherapy options are changing dramatically, sometimes becoming less toxic, often becoming more effective. But there's a lot of patients for whom we need to do more than just chemo. And that's where looking for a donor and the Anthony Nolan, with its large panel of donors, is very important so that we can move towards thinking about a transplant in the majority of patients now who aren't going to do well with chemotherapy.
How long? I know this is one of these very vague questions which you probably can't answer, but roughly how long do people spend actually undergoing the treatment before hopefully they're in remission?
No, it's a great question, and it's what every patient would ask. There's a good chance that just with 1 month's chemotherapy that you get into remission. That's delivered as an inpatient. Of course, it's pretty tough work. Some patients need a second course. And then the question after that, as I've said, is whether you deliver another couple of courses of chemotherapy or whether you go to a bone marrow transplant. So it's actually overall quite an arduous 6 months cycle of treatment. But as you said, now we're looking at delivering curative therapy to the majority of patients. And the prospects for this really difficult disease are transforming in front of our eyes. And that's where the work of Cure Leukemia and other blood cancer charities is so important in opening up access to these emerging new therapies for patients. And the great work that's happening at the Queen Elizabeth Hospital means that patients in Birmingham and the region are now really at the top of the list in seeing these new therapies.
Professor Charlie Craddock, OBE, thanks very much indeed for talking to us and explaining that to us this morning.